Most mosquito bites are just itchy annoyances, but some mosquitoes carry dangerous diseases. Dengue and malaria are two such illnesses. They affect millions worldwide, particularly in tropical and subtropical regions. Understanding these diseases is crucial for prevention and timely treatment. This knowledge can protect you and your loved ones. Both dengue and malaria are serious. They share some similarities, but also have key differences. This article provides a clear, concise comparison. We'll explore their causes, symptoms, treatment, and prevention. Knowing the facts can empower you. You can take steps to minimize your risk, and you can seek prompt medical attention if needed. Let's dive in and learn more about these mosquito-borne diseases. Dengue and malaria are spread through the bites of infected female mosquitoes. These tiny insects become carriers when they feed on the blood of an infected person. Dengue is caused by the dengue virus. There are 4 different types of this virus. This means you could potentially get dengue up to 4 times in your life. Malaria, on the other hand, is caused by a parasite called Plasmodium. This parasite has different species, each causing different types of malaria. While both diseases are spread by mosquitoes, the specific types differ. Dengue is primarily transmitted by the Aedes mosquito. This mosquito is recognizable by its black and white stripes. Malaria is spread by the Anopheles mosquito, which tends to be brown or gray. Understanding these differences is key to effective prevention. Knowing which mosquito to watch out for can help you take appropriate measures. This includes using mosquito repellent and eliminating breeding grounds. Let's delve into the transmission of these diseases. Dengue spreads through the bite of an infected Aedes mosquito. This mosquito is active mainly during the day. When it bites, the dengue virus enters the bloodstream. The virus multiplies, leading to dengue fever. Malaria transmission is different. The Anopheles mosquito, active at night, spreads malaria. The Plasmodium parasite enters the bloodstream. It travels to the liver, multiplies, then infects red blood cells. Understanding these differences is crucial for prevention. Using mosquito nets at night prevents malaria, but for dengue, daytime protection is key. Dengue fever. Recognizing the symptoms. Dengue fever often starts with a sudden high fever. This is usually accompanied by a severe headache, pain behind the eyes, muscle and joint pain, and a rash. Some people also experience nausea, vomiting, or loss of appetite. These symptoms typically appear 4 to 10 days after being bitten by an infected mosquito. They can last for 2 to 7 days. Most people recover from dengue fever without any complications. However, some develop a severe form of the disease known as severe dengue. Severe dengue is a life-threatening condition. It's crucial to recognize the warning signs. These include severe abdominal pain, persistent vomiting, rapid breathing, bleeding gums, and fatigue. If you experience any of these symptoms after a fever, seek immediate medical attention. Early diagnosis and treatment are vital for improving outcomes in severe dengue cases. Telltale signs. Malaria symptoms usually appear between 10 and 15 days after the infected mosquito bite. However, it can take up to a year for symptoms to manifest, depending on the type of parasite. The initial symptoms of malaria often resemble flu. These include fever, chills, headache, muscle aches, and fatigue. Some people also experience nausea, vomiting, diarrhea, and sweating. As the infection progresses, malaria can lead to more severe complications. These include anemia, jaundice, kidney failure, seizures, coma, and even death. One of the hallmark symptoms of malaria is cyclical occurrences of fever and chills. These cycles typically last 6 to 12 hours and correspond to the parasite's life cycle within the red blood cells. Early diagnosis and treatment are crucial for preventing severe complications from malaria. If you experience any of the symptoms mentioned, especially after traveling to a malaria endemic area, seek medical attention immediately. Identifying the invisible enemy. Diagnosing dengue and malaria involves identifying the presence of the virus or parasite in the body. Doctors achieve this through blood tests. For dengue, a blood test can detect the dengue virus within a few days of infection. This test looks for antibodies produced by the body in response to the virus. Malaria diagnosis also relies on blood tests. These tests can identify the presence of the Plasmodium parasite in the blood. Microscopic examination of the blood smear is often used to confirm the diagnosis and identify the specific species of the parasite. Early diagnosis is essential for both dengue and malaria. Timely treatment can significantly reduce the risk of complications and improve outcomes. If you suspect you may have contracted either disease, consult a healthcare professional immediately. Treatment and prevention, your best defense. Treatment for dengue focuses on managing symptoms. Rest, fluids, and over-the-counter medications can help alleviate discomfort. Severe cases may require hospitalization. Doctors might use intravenous fluids to prevent dehydration. Malaria treatment involves anti-malarial medications. Preventing mosquito bites is the best way to avoid dengue and malaria. Use repellent, wear long sleeves, and sleep under nets. Eliminate mosquito breeding grounds. Early diagnosis and treatment are vital. Seek medical attention if you experience symptoms. Take preventive measures to protect yourself and loved ones.